Okay. Welcome everyone to Doc Talk. We have a power-packed presentation for everyone. This is Doc Talk, Protocols for Health. I'm Dr. Josie Schmidt, naturopathic physician, and I have with me Dr. Mika Carew, naturopathic physician, licensed acupuncturist, and Louise Rose, Dr. Louise Rose, naturopathic physician. Hey guys, so we're here in the little boxes, but we have a PowerPoint today for everyone because this is juicy and it is chunky. We have a lot of information. What I encourage people to do is to take screenshots because these are protocols. There's a lot here. We're going to be talking everyone through them. And in October at our Essential Wellness EcoTrust live events, and then we have the recorded live webinar, and then it's recorded. We are going to do a formal presentation, fill out with much more, and have memes and have things for people. So this is kind of a sneak peek, and let's get started with our intention. Dr. Mika and Dr. Louise, do you guys want to say anything just in this opening slide in terms of this intention with these? We have 4 main categories of protocols, and we also are going to be going over what we are calling the baseline.
I would just say that this sort of grew organically out of us just talking to each other about after this last convention, when they came out with all these great oils, we started having conversations among ourselves about how to differentiate. Well, when would you use green mandarin? When would you put turmeric in? They're all so good. We want to take them all the time, but that's not realistic. So that's kind of how this started, was we wanted to be able to articulate to the team maybe some clarification about when you would use this versus that.
Mm-hmm. Yeah, these are, on the most part, protocols that we have come up with the newer oils, right? Since
Mm-hmm.
the last generation, because they're so therapeutic and powerful.
Mm-hmm.
And so we have had, a lot of protocols for inflammation, for a lot of these categories and things with some of our traditional olive oils, and those are still valid. So it's not like that there's always just one versus the other. We want to say that this is fluid, but these are protocols that are kind of in the now with the new oils that we've been working with and having success, and we wanted to help people and set some guidelines. Mm-hmm. My intention was to really help people. Next month, I'm going to go through with case studies with this, where we are, and see how this can help you. These protocols can help you if you are any type of wellness advocate and you are working with people and helping them and empowering them in their health journey and helping them to come up with a 90-day protocol. And what we realize is, people are pretty complex in today's world, and there's a lot of chronic disease. And it's not just like, well, here's an oil for this and here's a one supplement for that. After you get started, it can be that people really want a little more complex and expanded and comprehensive guidance and protocols. So that's what this is. This is a more, I would say, 202, or, a more advanced class. If you are new to the oils, just kind of put on your seatbelt, take this all in, and you can, integrate this as you go. So the conversation here is a little bit of a more, right, we would say kind of level 2 conversation in terms of thinking about working with a protocol or integrating the oils at this level. Okay.
I just want to say that, so the PowerPoints are chock full of information, and if it starts getting too much, I just want you to know what you're doing is fine right now. And if you just want to add in little by little, if you see something and you want to add just that one thing into your protocol, that's great. So
Yeah.
don't think that you have to go, oh my gosh, I need to like completely revamp and do a different protocol, and I set somebody on the wrong path. No, there's no wrong path. So you're doing great already. This is just 3 docs that can have give you a lot of information in a short amount of time. So you can also pick and choose. It's like a menu.
Yay. Okay. All right. So let's go to the baseline. We're going to be referencing this from now on, everyone. And it's going to be called the baseline. So probably the most common questions all of us receive as doctors in relation to doTERRA and natural health are questions on this that pertain to this page. And it is about, I want to say, look at the orange here, begin safe. Like, how do you do that with complex people who are on medications, who have multiple diagnoses? There's a lot going on, which is kind of the average person these days. How do you begin safely? Our motto is slow and steady wins the race. And you want to think about this concept of you first need and want to nourish the body. And really, we've talked about nourishing the cells, right? And then you want to help that system after it's replenished and nourished to go into some clearing and cleansing, but you don't want to do that first if they're depleted. So you want them to be nourished. And then you work through, and the oils are constantly doing this, the cleansing and clearing. And then you get to kind of what we call a maintenance place. And there's harmonizing. And harmonizing is a lot of with the nervous system and just getting into a good maintenance place. So our baseline, because all the protocols start with the baseline and then we add on, okay, is the LLV, work up to the full dose, okay? So as you notice, the first thing I'm going to talk about, the first little asterisk or caveat is, okay, what does that mean? So that's, I'm going to go over that, what that means. And so, but the baseline means get yourself up to the full dose. And a lot of the times we'll discuss this in the protocols. You don't really want to add too much of the rest of the protocol in until you're up to the full dose, because the full dose is where I and all of us, we recommend that this is where you want to be before you do any cleansing and clearing, right? Your cells need to be in your body, need to be in a nourished state at a cellular level. And the way they reflect that, an easy way to kind of say, well, what does that mean? How do I figure that out? That means you can tolerate the LLV at a full level. There's bell curve, of course, there's outliers for very individual specific reasons that have an extreme allergy or something like this that cannot tolerate the LLV. But in general, people are burping, things like that. That's not that they're an outlier. That's that they have GI issues that we want to work on and help them with, okay? So that's where you go up into the workup protocol. So that's where you see that you're seeing that the body can be working with the LLV. That gives us a sign that you're ready to now do like to go to the next level and do some more in-depth work. So that baseline is the LLV working up to the full dose. Terrazyme. I'm going to let Dr. Mika 1 cap 5 times a day. And then we'll come back to that, Mika, right? And I want you to explain that, the why, and then the citrus in daily water. I didn't put numbers here or drops. That is, again, individual. I did put it down below for if someone's super depleted and they're working on the alternate protocol. I would say no more than 3 drops a day of a citrus oil. But that range is really 1 drop to, I would say, 20. Depending on who you are and what you're doing and what other oils you're doing. In general, citrus in the water is about 2 to 3 drops per 16 to 30 ounces water bottle, whatever your water bottle is. So you just kind of work with that every time you fill it up. That's the guideline. You guys have anything you want to talk about the Terrazyme, the 1 cap 5 times a day?
Yeah, I do. Because I really noticed a difference when I do the 1 cap 5 times a day. But the reason why Terrazyme is a combination of different enzymes, and what happens in the body for most of us who eat a standard American diet, or that's not us, but even though we don't eat a standard American diet, our gut lining can become inflamed just because of external factors we're trying to deal with, or just even the organic food that we're eating. It's not the same food that our parents ate, right? Which had more naturally occurring enzymes in the food. So what happens with our brush border, there's something that's called a brush border in our intestines. Is this getting into too much detail?
Little bit. We got to keep it fast.
Okay. All right. So what happens is we need enzymes in our gut lining all the time to be able to absorb the nutrients that we take in and transform and transport that nutrients to our entire body. And it's important. You can't just take one at meals. That's the deal, is you need to inoculate your body first thing in the morning. So you'll have your Terrazyme right by your bedside, and you can wake up and then take that Terrazyme, and then already your body and your gut is being prepared to take in nutrients and food for the day. And then one with each meal, and then one before bed. How's that?
I would say really quickly, an easy way to remember that is we all know that you are what you eat, but you are what you absorb.
Thank you, Louise.
Yeah. You absorb. I love that. Is transmute what did you say?
Transform and transport.
That's Chinese medicine. Transform and transport. Yeah. And you got to be suspicious when you look at every single of the wise women, wise men, wise healers of every tradition. They talk enzymes.
Yeah.
We just took that Symphony of Cells with Boyd Truman, who had the kind of all of the wisdom from his mother, and is this tradition like his favorite and the one thing you take away from doTERRA, if there's just one thing, it's the Terrazyme, the enzymes. So yeah, that's why it's the baseline. Okay, so that's the baseline. I'm going to try and work through this quickly. The LLV workup protocol. So what happens when someone's having, before I go into that, nope. So here's the basic guideline, right? The basic guideline, and you notice I say down below, the time between steps is at an individual pace, but we have a general guideline that you start with the half dose, okay? So that's generally. If you have taken a little bit of information from the person and you find out they're on lots of medications, they eat a standard diet, they're very new to natural medicine, they've never done any cleansing or taken any vitamins, they don't eat that well, they might smoke or drink a lot, things like that, you might be suspicious that even a half dose is going to be intense for them. So you could start at the quarter dose, but does that give the parameters? That's the idea of, in general, you're going to say, let's start with the half dose. And you see how they do. So that general guideline is after 2 weeks, if they're doing okay, and I'm going to define okay, you move up to the next step. So you go from the half dose, we trial this first, then you move up for 2 weeks to the 3/4 dose, right? It's 4 pills of each bottle. So that's what I mean by quarter. That's 1 pill, half dose is 2 of each bottle, quarter dose is 3 of each bottle, and full dose is 4 of each bottle. 3 bottles, 4 of each. That's the math. And how do we define in a very general way? The things we're looking at is people's gut, their bowel movements, and their digestion, right? Things can go either way, right? So there can be, it's too loose or or they go into constipation. That's less common. More common is more diarrhea. So that's that reaction going in the downward movement with the bowel movements. There's things that can be happening with burping and feeling indigestion and things not feeling great. This stuff coming up is easier, right? This we know what to do. But so I say, are you regular and GI happy? So that's how we then move forward along that scale. if their reactions to the half dose, if things aren't getting better and they keep burping up and they're like, oh, I don't like this. This has this feeling. Or there's like, they're having diarrhea or they're having constipation and things aren't working in those ways, then it's that slow and steady. So always, it's like, okay, let's take a step back. Let's go to the quarter dose and see how your body deals with that. One of the things I like to say is, besides slow and steady wins the race, is too much, too fast, too soon. So a lot of times when you're seeing those kind of reactions from the gut in cells that are depleted rather than nourished, what we've given them, the LLV is very powerful. So what we've given them is just a little too much, too soon, too fast. So we're going to take a step back. So take a step back to the quarter dose and see how they do. That might be where they need to rest for a while, and kind of like you rest, and let's say the symptoms go down and they're okay, then you kind of stay there. And after 2 weeks of kind of having happy bowel movements and happy GI, you can try that. You can say, let's have you see how that half dose works again now. Okay. Mm-hmm. If reactions are still at the quarter dose, like, this is not happy, then you're going to go into the alternate protocol for 1 to 3 months, and you're going to see how things are. And if things are again, you want them to be for at least a month at a happy place with the alternate protocol, then you can trial back, because you just tell them, keep your bottles, you don't have to return them, put them on the shelf. They're going to wait. We're going to do this alternate protocol, and we're going to check back in and with that quarter dose in a little bit. In 1 month, 2 months, 3 months, we're going to see. So then you take them to the alternate protocol. This has worked really well for a lot of people. I've helped a lot of people with this. So when they're having symptoms with their digestion and their gut. So we go to the A to Z chewable vitamins, right? They're marketed for children. They're still great vitamins. You go to the 2 tabs daily. The liquid IQ Omega, again, marketed for the children's. This is a wonderful one for all of us to bump up our Omega doses and take an extra teaspoon daily. But you start them at 1 teaspoon daily. If things are going well for a while, you could even bump it up to 1 teaspoon twice a day. But just start with the 1 teaspoon daily. The Terrazyme. They need a lot of enzymes. They probably need more than this, but we do not want to overload their system. So you're going to stay with the 1 cap 5 times a day. The PB Assist Junior, we're going to get some good probiotics into them. But again, we're not going to do it in that capsule. We're going to start with the junior packets. We want them to experience the oils internally just a little bit, right? So we're going to be doing about 3 drops a day. Any of the citruses in their water, and then we want them to experience their body to start really having the healing effects with the oils. So you're going to be working on the bottoms of the feet. You could also have a topical, like some emotional blends and things that they're rolling on and using, great. But you want to be working in, I would say, both zendocrine and lavender at night, zendocrine in the morning, right? We're trying to upregulate a lot of their thing. All right, we have to get going. But that is, do you guys have anything? This is the baseline. This is, I've talked to a lot of people through this who've had difficulties with their customers with the LLV and like not knowing what to do. And this is really has worked for many, many people.
Mm-hmm. I would just say real quick, like if this is the main thing you get out of this presentation, most of your people are going to feel a heck of a lot better just doing the baseline. Yeah. And the other thing I want to say is Josie's going into details about what to do, how to troubleshoot if things are not hunky-dory when you first start on the baseline. However, in my experience, that is not that common. Like most people do just fine with the vitamins. So I don't want you to get the impression that, oh my God, it's scary. It's just sometimes, depending on your level of health, you might need to go a little slower, but most people do just fine and will make a huge difference in the way they feel.
Thank you, Louise.
Yeah, thank you.
As doctors, we get all the outlying situations. Mm-hmm. So we're speaking to oh my gosh, you have a customer and this happens, what do I do? But it's not normal.
And I have not seen it where I've had to even work somebody up. just so
There
you
you
know.
go. Look at that.
Yeah.
And you work with a lot of challenged people with challenged health.
Yes.
Yeah. Okay. So now we're going to go into our 4 categories, our 4 protocol categories. So I'm going to state them. These are just categories. They're not rigid. There can be fluidity. People are going to be in more than one of the categories, and we like to call them tendencies. Okay, these are just patients or people who have these family histories or have these tendencies or are working with them, and you want to help empower them with their health. So we're going to first go over cancer tendencies. We then have pain and inflammation tendencies, metabolic and cardiovascular tendencies, and neurological tendencies. So we're going to explain what we mean by these 4 categories. So when we say cancer tendencies, this could be that you have a family history of cancer and you want to be proactive. This could be that you have experienced cancer and you are now in recovery and what we call maintenance, right? Post chemo, post radiation, post whatever you did, and you're trying to optimize your health and everything. And this is what you want to work with. Yeah.
Can I just say that one of the things I teach people is that our bodies are constantly reacting to the environment and processing things and repairing things and detoxing things. And throughout that process, our bodies make cancer cells on a daily basis, even when we're healthy. And our body takes care of it by repairing it and letting those cells die. And so we basically all should be leading an anti-cancer lifestyle, a prevention lifestyle. So we all have cancer tendencies. It doesn't mean that we're all going to end up with a big tumor that we need surgery and treatment for, but think of yourself as just supporting your body's natural mechanisms to repair from damaged cells.
Yeah.
Oh my God, I love that.
Me
yes.
Too.
Yeah. We all do. I would say all 3 of us do our own versions of these kind of protocols in our own personal wellness. We do things as intense and active as these every day.
Mm-hmm.
Yes. So we have the baseline, which we just went over, getting up to the full dose of the LOV, citrus in the water, and Terrazyme 1 cap 5 times a day. So what we're going to add to that in terms of your pill intake is 1 DDR prime capsule 2 times a day. When we say 2 times a day, preferably we mean AM and PM. But sometimes, sometimes Mika, you'll say like morning and afternoon, lunch, right?
Yeah.
Getting it in 2 distinct times is what we mean. So 1 DDR prime capsule twice a day and 1 DBPC. What do you think that stands for? Deep Blue Polyphenol Complex. So that's our Deep Blue capsule. 1 Deep Blue capsule 2 times a day. That's what you're going to then add on to your Terrazyme and your LLV. Let's go into the internal blend. So when we say 2, when we do the thing, probably we'll get the graphic designer and do a cute drop. I don't have that technical capability. So we mean 2 drops, turmeric, 2 drops pink pepper, and 2 drops frankincense. However you want to get this in. A gel cap, tea, water, right in your mouth. It's up to you. Twice a day. What we're saying is this is not all that you can do internally. You could add some if you have some favorites. These are specific to cancer tendencies. These are the 3 that we would highlight that you want to make sure you are getting in, these 3 and the synergy of them working together. You guys have any?
I just want to say something quickly about DDR prime, and this is what I tell patients, is that as Louise was saying, we all need to be proactive in anti-cancer. And so one of the things, and you can tell people this, is you don't want the cancer cells to be suspended that your body automatically makes. to be suspended in your body. You want them to be broken down and transported out. So what DDR Prime helps to do, one of the big things, is that it helps it to be broken down and not stay suspended in your body.
Cool.
Thank you. Yes, you guys are doing the how, exactly. We are, all of us, this is how our body works, is that these kind of malfunctions happen, and then we're supposed to be clearing them. Cancer is just kind of a cell malfunction. And what the breakdown happens is when you can't clear it, basically. Yeah. And so almost all these things we're doing that are supporting the liver and our body's ability to actually clear these and get these damages and these malfunctions out of the body, and not then accumulating and creating a problem. That's when the tumors happen. So yes, and these oils are just incredible at assisting us with this.
There's a question here about, can we use this protocol during cancer treatments? I'll just put my 2 cents in, and then maybe you guys have a different opinion, but that is going to be a very individual question that you should take to your doctor.
Yeah, that's our stance.
Yeah.
We're not speaking to during. Yeah. Sorry, not on this webinar. It's a very individual approach. It's not something that you can just sort of make any statements about.
But it's a great question. And I also wanted to talk a little bit about my favorite supplement, the Deep Blue Polyphenol Complex.
Okie doke.
We all know it as a great anti-inflammatory blend, which is wonderful, because we know that inflammation is at the root cause of so many of these chronic diseases. However, if you break down all the ingredients that's in the Deep Blue Polyphenol Complex, there is a lot of research that supports all of those herbs as wonderful anti-tumor, anti-cancer support. So it's just a beautiful, beautiful combination that everybody can benefit from.
Thank you, Louise. I'm going to go over that more on Wednesday.
Awesome.
Yes. Anyway, but yes, I love, right? Just the turmeric alone, the form of the turmeric with its special absorption capabilities. It's 250 milligrams of specially absorbable turmeric. With the studies that they've done on that particular type of turmeric and the way it is created and made and put together, it's 7 times more absorbable and bioavailable. So I like to think of it is that you're taking 250 milligrams times 7, and that's something like it's over 1,000. Doing the math, it's like 1,200 or something like that. It really has the equivalency of its action in your body of that much bioavailable and active turmeric.
Wow.
The frankincense is double. So it is 100 milligrams. It's really more like 200 milligrams of boswellic resin acids. And it goes on and on. I love to talk about this stuff. So it is so powerful in the capsule of what's there because they are using very specialized forms. Okay. This is Dr. Mika's topical cellular blend. She has come up with this formula in practice, in action, with working with many patients. I want to talk about this specifically, Mika, and I'd say like our old teacher, Dr. Susan Lawton, when Dr. Mika says an amount of drops, she means that amount of drops. She doesn't mean like a few less. These are pretty specific protocols.
Yeah. Oh my gosh. So this was based on patients, and then also a lot of understanding from a Chinese medicine perspective, and from working with my beloved Dr. Ko, who was a mentor for me for many, many years. And he taught me about Chinese herbs. And then also from a lot of research in physiology and biochemistry. So it looks simple here, but there's been years and years since 1995 studying about cancer with a doctor who treated many, many different types of cancers, and coming into the the way of making this, or understanding from so many different points of view, from scientific Chinese medicine and from an elder medicine person. So it's 40 drops of frankincense, and frankincense is great. So what happens with cancer is that it likes to form a dome, a hard shell, so that nothing can penetrate it. So your immune system can't get to it and break it down. So what frankincense does is it targets and starts dissolving that hard dome or shell. Isn't that amazing?
It's amazing.
It's so specific. It rocks my world every single time. So then talking about it. And then the myrrh and the sandalwood, what happens with the cancer is it also likes to develop blood flow, nutrient flow, oxygenation, like highway systems directly to it. Isn't that crazy? So it likes to bring in the nutrients, and it starts forming highway systems of nutrients and oxygen and blood flow to that area. So what myrrh and sandalwood do together is to dissolve those highway systems. And the copaiba, that helps to unblock any bottlenecking of the highway systems. And it also helps to break down the highway system as well. It also helps with the dome. The lavender, that also helps an overall, but it's also like a harmonizer. In Chinese medicine, you have a harmonizer. And so it will help create a nice foundation for the entire formula to work in the most, the best way. So those are the drops: 20 drops frankincense, 20 drops myrrh, 20 drops copaiba, 15 drops sandalwood, 5 drops lavender. It's a beautiful.
In a 2-ounce bottle, and you fill it with fractionated
coconut oil. Mm-hmm.
Yes. And it's so interesting too, because, DDR has different oils. I think the only overlap is frankincense. And it works in similar ways, right? Because it works with, we know the thyme in there actually helps work against what the sandalwood and the myrrh are doing, those highways and the blood flow and stopping that. And then it's working on, right? So it's wonderful working with this topically, and then having the other internally, and then the DDR prime internal caps as well.
It's so comprehensive.
Yes.
It's hitting it from so many different ways. And imagine if you took this every day, I mean, I do.
Yeah, this is good for all of us. Yeah. So, alrighty, we just took the training with Boyd Truman called Symphony of the Cells, and oh my gosh, recommend it for everyone. You do not need to take the training. You just need to order his book that is on, they sell it on all the oil sites. Yeah, Mika, do you have it? And it is little, it's like $12, and it's called Symphony of the Cells. And it's these simple protocols that we love. The aroma touch technique, and we should have been putting this on here. Aroma touch technique is definitely for all of these tendencies, but we were just highlighting now the symphony protocols because they're things that you can do in home. You and your spouse, your kids, your people you live with, you do it on each other. They take about 10 to 15 minutes, and it's not special. You just learn it, you get going, and you start doing it. And they're very powerful. It's the application of about 9 oils on the spine, and you just apply it any old way, and the feet, and you just do it quickly, and you just get it in, and it's amazing. So these are the suggested ones out of the Symphony of the Cells. People could have other ones that are going to work great, but we're just giving some suggestions to begin with. The Maxim is that specific one for cancer tendencies. And then lymph, you want to keep the lymph draining. And if someone is post-chemo and radiation, Boyd Truman's recommendation, and we concur, is that the first directive is that you need to start rebuilding their digestive system and their lymph. So you're going to focus on the digestive protocol and the lymph protocol for a while. Okay. All right. Yeah? Should we move on?
Moving right along.
Yeah.
let's move on.
And just remember that if you feel like we're not giving you enough information about this, that we are going to go further, deeper into this in the fall. So hold tight. More is coming.
Mm-hmm.
Pain, inflammation tendencies, inflammation, pain tendencies, right? That could go almost with, it could overlap with any of the categories. Here is just, if this is the one you want to focus on, you can always, people can start to alternate them, because, you know, after a while you're like, oh, I'm doing the same thing, I kind of want to switch it up.
Mm-hmm.
But this is where this is really the focus. Now we want to get into, I think people understand the cancer tendencies. When we say pain and inflammation tendencies, let's get into what do we mean? So we didn't want to write it, but we're going to start telling some different diagnoses and disease states that would, that you would think about to use this protocol with. Looking at my notes.
Fibromyalgia.
Yes. So fibromyalgia, right? The main thing is pain and inflammation.
Yeah.
Chronic fatigue syndrome.
Mm-hmm.
Arthritis,
rheumatoid arthritis, and osteoarthritis.
yeah,
And all of the arthritis autoimmune states.
Mm-hmm.
Yep.
Mm-hmm.
Psoriatic arthritis, there's a lot of them. Anyone who's just in chronic pain.
yeah,
Chronic pain and
chronic fatigue.
Mm-hmm.
Yeah. You know, athletic histories, back pain, back discs, you know, doing behind me, right? Anything like that. This is the area that we're talking about. So the baseline, and then you're going to add on to the baseline 1 to 2 deep blue polyphenol complexes twice a day.
Yes.
Right?
Mm-hmm.
They might need more of this. You know, in states, do you guys think there's like a too much? You could go pretty high with the deep blue polyphenol complex.
Yeah.
I have people in states, acute chronic or with pain, where they've been taking 2 deep blue polyphenols every 2 hours.
2 hours. Yeah, I've prescribed that every 2 hours for somebody who is out of surgery and couldn't take any kind of anti-pain, any codeine or any other anti-pain prescription drugs. They took 2 every 2 hours. They needed to stay on top of that, but it worked.
Yeah.
Mm-hmm.
One thing we didn't put in here is you could also, in addition to that, take a DDR.
Mm-hmm, for sure.
I have had certain people with chronic fatigue and fibromyalgia for whom DDR was incredible for specifically their pain.
Yeah.
We didn't put this in here, like some of the old stuff, right, that we've used. People call it the pain or morphine capsules, and they use frankincense plus either oregano or thyme. It's usually frankincense and oregano. It's a lot. It's about 4 to 6 drops of each of those in a gel cap, and sometimes marjoram. So you could do 4 to 6 drops of each of those: frankincense, oregano, and marjoram. Anyways, those are old ones. Those are extras. Those are just things coming off the top of my head. So internal blend. We love this. This is I do something like this every day.
Mm-hmm.
2 drops of frankincense, 2 drops copaiba, 2 Siberian fir. Remember, that's our trifecta blend. It's right in there at the top.
Yeah.
And then we're adding 2 drops of turmeric, 2 drops of pink pepper. Pink pepper works the LOX5 pathway. We have 2 main pain pathways. We have the COX-2 and we have the LOX5. Isn't that fun? We can make a song about that. But anyways, the pink pepper works that. Really important. And then 1 of ginger. You just need 1 of ginger. Ginger's really strong. Yeah. Again, drink it in tea, water, gel cap. And then you notice the same oils, similar, right? We have 10 to 15 drops each: frankincense, copaiba, Siberian fir, turmeric, pink pepper. So you're buying those oils, your person is, and then you're making a topical. This is my little thing. I love how magnolia works. It is like lavender on steroids. for the muscles and the nervous system and the relaxation. You
Yeah.
know, lavender has about in the 30 to 35% linalool. Magnolia has 70% linalool. That's the thing that's like affecting our nervous system and making us chill out.
Yeah.
And it does that, all of that. So it's really wonderful for the muscles too, as you're working with these other ones. So I like to then get a 10 mil and I put those drops in, and then I fill the rest with Magnolia. And then that's your baseline roller. And then you want to layer one of the blends that works well for you, that I said, now you put on the mints, right? You do either deep blue oil or deep blue rub or aroma touch, or you do all three. You do your topical blend first, and then you do aroma touch blend, and then you do deep blue on top.
Yeah.
Yeah.
Mm-hmm.
You guys, okay.
Yeah.
So those are those options. The symphony protocols, recommend the inflammatory. The Chi is inflammatory 2 protocol. It's pretty much the protocol that Boyd came up with the new oils. So it's just kind of updated. So they're both good to alternate the inflammatory and the Chi. The infectious disease one can really help too, and the lymph. And then we have this, Dr. Mika and Dr. Louise work together on this protocol. What this means is, because I have here topical blend or layering. So what we mean is in a 10 milliliter, you are adding these oils in, and then the fractionated coconut oil. For making the blend in a 10 mil, that's the ones over on the left, right? That's the 30 drops of aroma touch, the 20 drops of copaiba, the 15 of marjoram, and the 2 of ginger. The little drops over in the parentheses, that's for if you are going to be personally, like it's a back thing and you're doing it on yourself, or you're doing kind of your own version of the symphony of the cells, and you're just putting these, you haven't made a blend and you're just going to layer them on. It, like during the day, you're like, okay, I'm doing my aroma touch and then my copaiba and then my marjoram. Because when things are really acute, that can be more effective. So these are the drops that you are going to do your own little symphony version. 5 to 8 of aroma touch, 10 of copaiba, 3 to 5 of marjoram, and 2 of ginger, in this order. Mm-hmm. Yeah, you guys, same thing. And then you alternate. This was like, you guys want to, I just reading it off, you should talk about it.
Yeah, no, go ahead.
Yeah.
No, I just said then alternate with the other one, and it's the same.
Mm-hmm. Yeah, marjoram is sort of an unsung hero in my book. It has so many wonderful applications for pain and relaxing the muscles, and wherever there's like tension, and it really can help. And we are probably more familiar with things like aroma touch and copaiba for helping pain, but the marjoram can actually help usher those things into the muscle and sort of break down that barrier. And then the ginger is really warming and anti-inflammatory. And would you say, Mika, that from a Chinese medicine perspective, a lot of these inflammatory things seem to be hot, but it's more of like a false heat, that you want to actually kind of bring that warmth and circulation to the joints with the ginger?
That's a good thing to say. So what happens a lot of times is it's cold wrapped around heat. So the cold is on the inside that got stuck, and then there's heat around it. Mm-hmm. You actually have to, so the ginger and the marjoram, the lemongrass, that whole thing is great to kind of get into like the ushering. I love that word with the marjoram, ushering the other oils into that cold, and then breaking up that cold with the heat, with the ginger and the lemongrass. And then the aroma touch can help to disperse and then transform it.
Mm-hmm. And with these topical blends, I think people don't understand like that they can apply them frequently, and every hour just do a little dose. Like if you're in a lot of pain, it's very safe to use these oils topically on a regular basis. And the more sort of rhythm that you can apply the oils to your pain points, the more your body is going to start to say, oh, I can shift away from that. Because we get into a feedback loop with our brain and pain, and what we're trying to do is change that feedback loop. So don't be afraid to use these topical blends frequently.
All right. Great. Let's move on to metabolic and cardiovascular. This one's a little chunky. We had a lot of extra ideas. And so what do we mean by metabolic and cardiovascular? Gosh, we mean any kind of cardiovascular issues that people have been working with. There's a lot of that, right? Hormonal issues in this category, metabolism, blood sugar issues, hypertension, low blood sugar, low blood pressure. Hypertension is high blood pressure. PCOS, polycystic ovarian syndrome. That would be a kind of a dysregulating hormonal system. Syndrome X, a lot of the hormones and the cardiovascular and the lipids are all kind of out of balance. Metabolic sugar. Blood sugar, metabolic syndrome. So pre-diabetes, diabetes, all types of diabetes, and then pre-diabetic states, thyroid issues, weight issues. Okay. Let's go. The baseline. Yay, start there.
Yay.
And to that, you're going to add, now's when we're highlighting MitoMax, Mito2 Max. One Mito2 Max twice a day. And then we're going to bring in a daily PB assist, right? There's a lot going on with this where we want to work on the liver and the digestion and focus there. So that would be our priority in terms of the supplements. And then we go in for the internal protocol, right? With oils. And this is where we're highlighting Yaropalm. 2 drops Yaropalm twice a day. So I say work up to, you can watch our other webinars on the Yaropalm and how amazing it is and how powerful it is. So this is one that you want to start with just 1 drop once a day, and then 1 drop twice a day, and then go up to the 2 drops. People can have, it'll really bring up their stuff and their deep emotional stuff. And so sometimes people start feeling things that they haven't been feeling. And that can get intense for them more on a spiritual, mental, emotional level. That's why we say diffuse blends that contain either Litsea, or if you don't have Litsea, lemongrass. We want things, DDR is a good one to diffuse as well. This is to help clear and clean all of that your energetic and your emotional space and your brain and your brain chemistry. So the 2 drops of Yaropalm, and I'm going to let Dr. Meek and Louise talk about that a little bit, the why, the Yaropalm, and then Slim and Sassy, getting up to the high dose, the full dose, which is technically 5 drops 5 times a day. We say here 5 drops 4 to 5 times a day. You can do Slim and Sassy right in the mouth, or you can put it in your water, and there is the gel caps. You can alternate these in the 4 to 5 doses throughout the day. Again, you want to work your way up to that. Don't have people just taste 1 drop of Slim and Sassy for the first couple times that they actually are taking it in and tasting it. People get sick of taking that high of a dose of Slim and Sassy forever. So for a long time. And it's better in general. It is better for us to our bodies upregulate and downregulate. They get used to things and then make changes. Our body does that. So we do want to be alternating these protocols and switching things up with our bodies, with a lot of the internal dosing. So alternate every 6 months between taking the Slim and Sassy, and then from the plain and inflammation, taking that inflammatory internal blend that we just went over. Okay, so you do 1 for 6 months, but you want to start with the Slim and Sassy for the first 6 months. Let's have you guys have some comments just about that before we go into the others.
I just want to quickly comment about Slim and Sassy. So you could also, if you don't want to take all the drops, and you want to start out slow, you could also put it at the bottom of your feet and also diffuse Slim and Sassy. So that's also a good way. Like if you want to start out with like 1 drop twice a day if you're just starting out minimally, and then you can put a drop or 2 on the bottom of your feet and then diffuse it, and then you can get more drops in.
Mm-hmm. You can also rub it right on your belly with a little massage oil or lotion or something like that, because when we have metabolic problems like with blood sugar or overweight or a lot of these different things that we're talking about, oftentimes our belly fat is where we have a lot of the inflammatory hormones coming from, and it actually makes it harder for us to lose weight when we have a lot of belly fat and have this dysregulation. So of course there's no scientific study that shows this, but my theory is that if we put the Slim and Sassy right on the belly fat, it's going to help with that process. So that's what I like to do.
Great. So let's talk about those. And anything about Yaropalm that you guys wanted to, why we're recommending it specifically here?
Oh my gosh, it's so good. And we did really go into a lot of detail on another call. So if you haven't listened to our Yarrow call, I would recommend doing that. But it's so good for, I think Mika explained how it's good for all the branching vessels. So both of our nervous system and our cardiovascular system. And what we're discovering is that it really harmonizes the hormonal system as well. And all of those systems coming together allow, when they kind of come into balance, then it allows us to lose weight kind of naturally. One of the side effects that we are discovering with using it is that when we lose weight, we're also kind of purging some of the toxins that have been stored in our fat cells, and that if we're not aware of that, it can kind of feel like an emotional purge as well. So we recommend that you just start slowly with Yaropalm, 1 drop a day, and just see how that feels for a while. And if you're feeling fine, you can increase it to this full dose. But recognize that if something comes up for you, what you need to do is support your system. You can back off of it a little bit, but you can also support your detoxification systems that are natural in your body. Take a hot Epsom salt bath, do some exercise, get some body work, drink more water, and maybe do some emotional clearing as well. That kind of
Great.
Yes. Yeah, I mean we've kind of talked it through.
Recommend going back and watching that. It's a previous doc talk. And I'd like to just say I like using Slim and Sassy's other the name. It's the Metabolic Blend.
Yeah.
They market it cutely with Weight Loss Slim and Sassy. It is so powerful, and it is such a beautiful blend. As doctors, we all love this, as it's just incredible. It's the essential oil blend with cinnamon, peppermint, ginger, lemon, and grapefruit, right? It's the foundation. So call it the Metabolic Blend if you don't like Slim and Sassy.
It's so good on a physical level for what we're talking about with the blood sugar and the metabolism changes, but it also is really helpful for changing your emotional relationship to things that can be addictive or that you might reach for in a way that is not healthy. So it's a wonderful way to kind of interrupt those old patterns. So I love using it that way too.
Like having a craving, and rather than going to the craving, take some Slim and Sassy and put it on your tongue, for example.
Exactly.
So we have our other things that we recommend. Clary Calm for everyone, all hormonal issues. I love this blend. This is the hormone blend, hormone balancing. So daily I keep this with all my oils and creams up in my bathroom. I keep my Yaropalm, so every morning do 2 drops, and in the evening 2 drops. My Yaropalm's there, my Clary Calm is there, and I rub it on my lower belly, use my wrists to rub that in, and then I rub it on my fingers, and I do the back of my neck, behind my ears, and then this thing, the lymph pee deodorant plus body mist. So I'm going to tell you guys about this with doTERRA's new deodorants that they've come out with. Love that. And I still love, we have the lymph blend. And so you can also use our old lymph blend, which is a combination of frankincense, geranium, wild orange, and grapefruit. Yummy, super delicious. And making that up with coconut oil. And I find that all the deodorants work better when you have your lymph blend applied first, and then you put your deodorant on, and then you're also working your lymphatic system. Now, this is so I ran out of my lymph blend, and I had my Clary Calm, and we got that new body mist, right? The beautiful blend, the beautiful body mist. And so I did a little cheat, and I was like, oh my God, I love this. And so now what I do is I'm going through a phase where I'm not using I used our lymph blend for years and years and years. I do a little roll of the Clary Calm on my fingers, and then I squirt a squirt of the body mist in, and now I apply it. I apply it into my underarm area and go 1, 2, 3 down, 1, 2, 3 over, right? Both sides. And then I apply my deodorant. Very great. That's great for everybody, but we're highlighting it here in the hormonal metabolic area. We have these 2 traditional teas that are just fantastic for different things. So the cassia is in the cinnamon family. It's just like cinnamon. Cassia and fennel tea, wonderful for blood sugar and hormonal balance. And by the way, super delicious. So 1 to 2 drops of each in for a cup of tea. Lang Lang and black pepper, really great for blood pressure. So drinking those together and with a little bit of honey, delicious. Zendocrine. So everyone, Zendocrine oil, we love this oil. Dr. Me can spend a second. I know we're going to go over a little bit. You kind of expect that with Doc Talk. This is a pretty
Can you see me?
But I know you want to talk about Zendocrine and the love of it. So we're recommending here many ways that you can use it, but getting Zendocrine in daily. When I do my hormone balance protocol, it is Zendocrine daily on the bottoms of the feet. That could be the most simple way. You could do a little bit of Zendocrine. You can always do that body mist or any kind of carrier oil with it. And you just do clockwise circles around the belly button in a kind of large, great. I'm going to do my Josie thing where I come up, right? Like this. Clockwise around the belly. Okay, just like this. I did this morning. I do this every morning. With castor oil packs, Dr. Louise has so much. You can go to her website, rosecabinetmedicine.com, and check out her downloads for how to do a castor oil pack if you don't know how to. And then you add Zendocrine oil in with the castor oil, and you're doing that always. I always do that now. Dry skin brushing. You can add some Zendocrine on the dry skin brush and then do your dry skin brushing for your lymphatic. And we already talked about the Slim and Sassy, that you can also do that in that circle on the abdomen as well. And then we're recommending in general, doing the doTERRA cleanse twice a year for this category. Everyone else, minimum of at least once a year. But this is a focus where with the baseline and everything, you're going to work yourself up to a good place and then work into a doTERRA cleanse twice a year. Nika, I don't know if we want to talk about Zendocrine at all.
Okay, so you can see me? Can you hear me?
Mm-hmm.
We can hear you. You're frozen in your picture.
Yeah. So I don't know what happened. Somebody called and I had it on. I didn't think it would work. Zendocrine is so great to help with filtering out every organ system gently and effectively. So that with the citrus water is fantastic. So that's why we have it here. It's a great filtration. And as you said, Josie, and Louise, about the yarrow palm, it's really important to filter out those organs, and then you'll be less likely to have some kind of side effect, of emotional side effect, because that's just telling us that our organs are a little bit clogged up and are needing some help filtering. That's the bottom line.
Yeah, a lot of hormone imbalance is really that we need to really support our liver and our organs of filtration.
Mm-hmm.
And just the beauty of the Zendocrine blend itself and how specific it is in terms of its symphony of synergy of that blend.
Mm-hmm.
Yeah. Louise, anything else, or should we go to neurological? Or
I think we can move on.
we're going to move on to neurological. This is our last protocol. So when we are speaking, of neurological tendencies, this might be the category that people are like, what do you mean by this? So we mean a lot. This is a kind of a broad category. All things to do with the brain, right? Like brain and nervous system diseases, brain tendencies. So, that could be from dementia to Alzheimer's, to traumatic brain injury, to trauma. So then that moves into the emotional states with those things, right? That in terms of trauma, anxiety, depression, let's see, migraines,
insomnia,
autism spectrum, migraines, MS,
multiple sclerosis,
attention deficit, ADHD, anything else, you guys, that okay,
some of those chronic pain things can turn into a neurological, there's a lot of overlap, so you can think of.
Okay. So go quickly, the baseline, and then you want to add in, when you're really trying to support your brain and your nervous system, you want more than what's there in the full dose of the LLV for the omega support. So 1 teaspoon twice a day, in addition to the LLV of the liquid IQ omega. 1 deep blue polyphenol complex 2 times a day, and then a PB assist, so 1 probiotic daily. Then we, in the internal protocol, again, the cardiovascular and then the brain and the nervous system are really the playing field of Yaropalm. And so 2 drops of Yaropalm 2 times a day. Same thing, work up to. When you're working with Yaropalm, make sure that you're working with your filtration and your elimination systems on all physical and emotional levels, and the diffusing with the Litsea or the lemongrass or the DDR can really help with that. In addition to other things, right, that we talked about. And so then here we have the baseline of 2 drops each of frankincense, copaiba, and turmeric. Those are kind of that's the baseline. Those are your 3 big guys. And then Louise is going to talk about this after I go through the thing of, she's had some wonderful experience with those and with helichrysum. So if specifically Louise is expert, she deals with people with a lot of different versions of traumatic brain injury and trauma in particular. So adding in 2 drops of helichrysum, if you have any of that going on. And then we have pink pepper and green mandarin. And so you could put all of that together in a gel cap, a tea or water. We like, this was Louise's too, the recommendation is if you want to separate it and have your gel cap here, and then pink pepper and green mandarin are delicious in water, daily water. So you can be drinking those in your water and adding in a citrus if you want, but the citrus is the green mandarin, sorry. So you're choosing that as your citrus and then your pink pepper and you're just drinking it. That's an option. I'm just going to go through and then we'll talk about it. So symphony protocols, neurological and sensory would be the 2 you would definitely highlight. And then topical, we have such great blends here. We love Immortel. Immortel is, on the highway to the brain, back here in the back of the neck, and or in tune, right? Frankincense and patchouli, really important. They're both in tune. And I said you could use Immortel and Frankie. I mean, we love frankincense always. So you can add that in when you're using the Immortel or in tune, and just working those oils back here, the brainstem, and up into the little notch right here in the back of the head, minimum twice a day, but you could do more.
I do want to say something. Am I still frozen?
Yeah.
I'm here, okay. Everyone. I've been here. I don't want to touch anything because then I might not be even available. So the Intune has been really effective with helping people be family members and patients who have dementia or Alzheimer's have a little bit of clarity. The patients have a little bit of clarity in their symptoms, which is really helpful for their family members. So it gives them a little space in their brain, wherever they are in Alzheimer's or where they are in dementia. If you do in tune, like you said, Josie, in the base of the neck, and you do it regularly for your loved one who might be suffering from dementia or Alzheimer's, you can help them get a little space from that. Just a little, maybe even if it's like a minute or two of a wake up. That's priceless, really.
I would say too, of course, we're dealing with a whole spectrum of conditions and people in different states, but these kind of conditions that Mika's talking about, where somebody might be very elderly or very sick, or maybe there was a stroke or something that was really serious, diffusing frankincense can be life-changing for them.
Yeah.
And they're just breathing it in, and there's nothing difficult.
I would say if they're okay with the smell of patchouli, frankincense and patchouli is
That'd be great.
Louise, can you talk for a second about your helichrysum and your traumatic brain injuries or trauma?
Yeah, so the brain is a very interesting thing. It's very soft and made up mostly of fats, and but it's inside this hard skull, which the skull protects it. But traumatic brain injury refers to someone basically who's had a concussion or a head injury. And what happens is the soft part of the brain slams up against the skull, and it causes inflammation that can have long-term problems. The brain doesn't have the same way to shut down the inflammatory process that the rest of the body has. And so one of the most important things we can do after any sort of head injury, and we're learning that even small head injuries without losing consciousness can have big effects. So don't underestimate if you've hit your head, it just, do this protocol for a while to stop any inflammation. But I've had really good results with the internal use of frankincense, copaiba, and helichrysum. And then now that we can add turmeric, it's just an amazing combination. So I would do that 2 drops of each in a gel cap at least twice a day and 3 times if it's really serious, and see, do it for 2 weeks, and then maybe take a week off, and then, pulse it like that. And then with your high dose of the fish oil, that's going to be really important as well.
Yeah, like Louise, you're speaking to, because this category is one where there could be an acute, like you could have, oh my God, I just had a concussion. In those kind of states, that's when you go up, you do more. This is more of a kind of like chronic protocol for kind of someone who's in a dementia stage or has some kind of thing going on. So when we say daily and gel cap, that's a maintenance protocol. So if you're in something like you just had a concussion or a trauma, you would want to be doing that like 3 times a day. And putting topicals on the back, the area and the neck every 2 hours. And then getting in the IQ Omega 1 teaspoon or 2 teaspoons, go higher basically for a couple weeks. That's cute. So you can go high for a while and then you go into maintenance.
And the deep blue polyphenol complex too is great for shutting down that inflammatory process. It's like, really taking a fire hose to the inflammation, and it can really help you from developing long-term problems if you really treat it well in the acute phase. There's a couple questions here. I don't know if you're ready.
Before we go into that, I don't know that we have time for questions unless, you can take them to the page and we can try and answer them on our page. So Mika, I wanted you to speak to kind of a chronic kind of more state with your dad, right? He's been doing kind of this, hasn't he?
Yeah, he has been, and he's not one to be really compliant on the things. Let's just say
he's a dad.
He's a dad.
Is he's in his 80s.
Yeah, he's 86. He still works, and he's had he was in an accident, rear-ended, so he had a whiplash. And then, my mom, they've been married since they were 17 and 18. She had a couple falls, and so he was having this. I went home, and he was having this internal tremor, shaking, and he was saying, Mika, I have this internal shaking and it will not go away. And I put him on the yarrow palm, the frankincense, the copaiba, the turmeric, pink, all of this. He's taking it daily, twice a day. And this is something he's compliant with, you guys. He says it takes about 10 to 15 minutes. Like, he'll feel the shaking, and I think it would take less time, except for he doesn't pay attention to the shaking until it's extreme inside his body. Just saying. But when he takes the yarrow, this whole protocol, which he's really compliant with, he says that whole shaking thing goes away. And also he feels calmer, right? So he's doing great with it, and he won't go without it. And that's a big deal for a 86-year-old man that's kind of set in his ways.
Yeah, right? Yeah. A lot of the guys, like, it's working when they actually are like, where's that stuff?
Yeah, where's that stuff?
They want it, they're asking for it. They don't care unless it really works.
Yeah.
All right. Louise, was there anything we should quickly address?
Well, I just wanted to mention that we've said on a couple slides here, diffuse blends with Litsea or lemongrass. And Mika, do you want to say why that people might be?
Yeah. So when I was taking a pretty high dose, I started out with the high dose of the yarrow palm, and I am not one to kind of tank into sadness and lethargy. That's kind of not my normal state. And so I didn't put it together with yarrow palm yet, because that's when we first started it. And I automatically just started to diffusing and putting on my scarf, Litsea. And because Litsea is like the sun. And I was like, I am in darkness. And I want to inquire about this darkness, actually, because I feel like when we go into different emotional places, it's a really good thing to see what's there and what's hiding and what's coming up. But Litsea helped me transform some of that dark, heavy feeling and emotional state. And so I was diffusing.
Not get stuck there. But
yeah, it got stuck. That's what happened.
Like a mirror, contemplate and look at why is this coming up? So that's what we talk about in our yarrow palm call.
Yeah.
This isn't just you're going into darkness for no reason.
Yeah, no.
You're stuffed with a great opportunity to look at it, and then you want extra tools that are going to help you transform that.
Yeah, transform it. Yeah. And not everybody's going to do that, but that where I carry my weight is in my belly. So, of course, yarrow palm is going right there, which is woohoo, to go get that stagnant energy, lineage old energy, and help me transform that. So Litsea and if you didn't have Litsea, lemongrass is a great one to use too. Mm-hmm. Or I just got tired of Litsea, so I went to lemongrass.
Yeah. Thank you.
Right. Mm-hmm.
Well, we are a little over. Thank you, everyone. So this has been, I'll go back through it, our doc talk and our protocols for health, our neurological tendency protocol, metabolic and cardiovascular tendency protocol, inflammation and pain tendency protocol, and cancer tendency protocol, and then going over how do you work people up safely into the baseline. And there you go. Thank you so much for joining us. Next month, we're going to be continuing with this idea into some case studies and how you actually work people up into these protocols in a 90-day protocol that you can talk about at your lifestyle overview and your wellness consultation. Thank you,
Dr. Josie, for these
Yeah.
great slides.
All right.
Everybody, thanks for being here.
Yeah.
See you next time.
See you next time.
Thank you.
Bye.